Welcome to Dialogue Across Difference, an event series hosted by the Center for the Study of Politics and Governance at the University of Minnesota's Humphrey School of Public Affairs. Join us as Center Director Larry Jacobs and guests engage in conversations across the political and policy spectrum on issues of the day.
Good afternoon. I'm Larry Jacobs, and I am a faculty here at the University of Minnesota in the Humphrey School of Public Affairs, which is the University of Minnesota School of Public Affairs. I want to just a couple quick things. If you are coming to us via Zoom, welcome. You'll see at the bottom of your screen that there is two buttons, virtual buttons. One is Q&A. That's how you give us questions and participate in today's conversations. And the other button at the bottom is transcript, live transcript. So if you'd like that service, just click on it. You'll get a live transcript of the conversation today. I am just thrilled to have this opportunity to be part of today's program on a better path to achieving public safety. We have a terrific set of conversations coming forward. I want to first just take the opportunity of welcoming my friend and collaborator, Norm Ornstein. Those of you who follow politics will know Norm Ornstein as one of the premier scholars and commentators on Congress. He has spent more time and been more successful in achieving important good government legislation in Washington than anyone I know. So it is really a pleasure to have Norm Ornstein with us today. Norm Ornstein.
Thanks so much, Larry. I could start by saying I'm from Washington and I'm here to help. But while I come from Washington, I'm a Minnesotan. I was born here. I went to this great university a long time ago. I identify as a Minnesotan. My Vikings hat is over there. I left my Twins hat at home, and I care about this state. Now, as Larry said, my specialty is American politics and Congress, but I've gotten very much immersed in trying to reform the broken mental health care system. And also now, as we see the very direct intersection that it has with the criminal justice system and the system of policing that we have. And I've done this really not out of a direct, meaningful choice, but because, like so many others, and there is scarcely a family in America that hasn't been touched by all of this, mine was hit with an enormous tragedy. I had a son named Matthew, who was a brilliant young man, national champion high school debater, went to Princeton and excelled, was out in Hollywood and doing well when at age 24, he had a psychotic break and went through 10 years of hell, as we did in his family. And because a part of his brain disease was something called anosognosia, where he had no insight into his illness, something that hits very large proportion of those with serious mental illness, he would not accept treatment. We were powerless. We couldn't even find out at times whether he was in a hospital or where he was. And it became clear that the system just wasn't responding the way it was supposed to. And while he did not have serious or deadly encounters with the criminal justice system, he died accidentally of carbon monoxide poisoning at age 34 after these 10 years of struggle. And my family, my wife, Judy Harris, my other son, Danny, and the rest of us decided that we needed to do something to turn grief to purpose. And we've been involved very deeply in trying to change this system. We're trying to do it nationally, but also recognize that this has to happen at the local level and at the state level. And what we learned along the way, especially as we went down to Miami-Dade County, Florida, and encountered the remarkable judge who's with us today and who you will hear from a little bit later, named Steve Leifman, is that there are ways to save lives and save money at the same time. There are ways to reform the criminal justice system and the way policing is done while we can also help those with serious mental illness get back on their feet and resume the lives that they should have from what is a disease of an organ. It's a brain disease. There's nothing willful about it, but they're often helpless in this process at all levels. And one of the worst things that can happen is if a family member in most places in the country calls the police because there's a crisis going on, but not knowing whether that will end in an even deeper tragedy rather than in finding somebody help. That's true at all levels. Minnesota now is in the national spotlight for a whole host of reasons, and they're not good reasons right now, but there is an opportunity here to be able to affect change. And that's what this program is about, as a start, not an end point. But we're going to start right now with the great Larry Jacobs in a conversation with the new Chief of Public Safety here in Minneapolis, Dr. Cedric Alexander.
Thank you. Good joining. Those of you who are joining us online, just want to give a quick introduction to Dr. Cedric.
Move the mic a little closer to you. I don't think, yeah.
I'd like to give a quick introduction to Dr. Cedric Alexander, who was just approved as the first Minneapolis Community Safety Commissioner. The number of hats he's wearing, it's incredible. It's basically fire to police and a lot of stops in between. He spent over 40 years as a deputy police officer, a detective, deputy mayor, and a police chief in cities across the United States. He also has a doctorate of clinical psychology, which is quite appropriate for our conversation today. First, I want to welcome you, Dr. Alexander, and thank you for joining us today.
No, thank you for having me. Can you hear me okay? A little bit closer. How about that? Okay. All right. No, but I am delighted to be here. First of all, I'm delighted to be here at the university, and equally as delighted to be here in the city of Minneapolis too, particularly in this, in this time and space and history of what's going on across the country as it relates to public safety. So this is not somewhere I had intended to be about 6 months ago. But I got a call from Mayor Jacob Fry, and he asked me if I could help in terms of where they wanted to take public safety in this community and his ideals about it, and bringing all these different platforms of public safety together, police, fire, emergency management, et cetera, under one umbrella. And this is new to this community. It's not new to me because, quite frankly, a few years ago, I held this same position in DeKalb County, Georgia, which is a huge metropolitan community right adjacent to Atlanta. And the responsibilities were virtually the same. But of course, the circumstances and personalities of those communities are very different in a whole lot of different ways. So looking forward to the opportunity to, along with the community, to affect some change in terms of where we have been and where we are and where we need to be.
Norm Ornstein, you'd like to get us started with some questions?
Sir, so the first question I'd like to ask you is, how does your degree in clinical psychology help you in your various roles?
Well, it keeps me sane. That's the first thing it does. And let me tell you a little bit about, on a serious note, about how that all evolved for me. I spent a number of years in Miami, actually, as a police officer with Miami-Dade Police Department. And I left in '92, decided to go do a doctorate in clinical psychology, attended Wright State University up in Dayton, trained at the University of Miami and the University of Rochester, schools of medicine at both those institutions in the Department of Psychiatry. But for me, actually, when I left policing in '92, excuse me, my intent was never to go back. I was finished with policing. I did it for about 15 years or so. And I thought I would spend the rest of my life being a mental health provider. But when I got to Rochester, New York, to do a postdoc fellowship for a year or two there at the institution. I ended up working for the next 5 years in the Department of Psychiatry, seeing general population patients. But along with that, also the university had contracted with the city of Rochester that all their trauma-related cases involved their police officers, firefighters were referred to me specifically because of my background as a police officer and now as a psychologist. So I did that for about 5 years. Mayor and I became friends. The city of Rochester were having many of the same issues that's going on in this community today. He recruited me over as a deputy chief in 2002, and I never did go back into psychology after that. But it was never my idea to go back into policing. But I tell you, having been trained as a psychologist, having worked as a psychologist, and I have led a number of departments across this country, both at the local, state, and federal level, really has benefited me in the sense of being able to understand, have a better understanding and insight into how people function inside different organizations, and particularly in leadership positions. It benefited me to understand the people that were working closely around me and being able to have better insight into their strengths, their weaknesses. And that allowed me an opportunity to work with them and help develop them into the next generation of leaders. And partly before I came here from Pensacola, that's what I was doing a lot of consulting and certainly working with a number of new emerging chiefs across the country. And now here I am again back in the public safety arena in a community that is still considered the epicenter of civil unrest and police reform, if you will. So this is a very unique time for this community. It's a very unique time for me in the history of my life. But I answered the call of the mayor, and that's the only reason that I'm here. But I think it's a great opportunity if we look around and see how public safety is attempting to emerge and grow and expand the way that we do business, particularly around the whole subject around mental health, a much more balanced approach to it now, of thinking about it in a very, very different way. And real quickly, I served on Obama's task force for 21st century policing through executive order. Myself and 10 other people were selected across the country for that. And in that document, if you're familiar with it, and we had 6 pillars in that document that we were asked by the president at that time to formulate a document post Michael Brown event that would provide a roadmap to policing in this country, something that you could refer to. And we went across the country, talked to a number of organizations, human rights, civil rights, academics, you name it. And we compiled all this information with support of White House staff over a short period of time. We only had 2 months to pull this together, but it turned out to be one of the most, I think, and maybe I say this with some bias, but it really turned out to be a document that still to this very day, many law enforcement agencies refer to when they get stuck. And it's not anything that's in the document that's profound, but there's some things in that we've learned, like in Pillar 6, when it comes to officer wellness, the importance of being conscious of that and things that we need to do to help officers to be able to perform their duties when they're in such a stressful type of job, if you will, that over a period of time, the duration and frequency of those events that they experience do have impact upon them tremendously, both psychologically, physically, emotionally, etc. So the document has served to be of some real benefit, and but the work and some of the writing and op-eds I've done in more recent years, I hope has contributed to us continue to think about how do we look at advancing police in this country in spite of the challenges that are in front of us.
One of the concerns here in Minnesota has been about integrating policing, mental health for both the police officers, but also for those who are being brought into the criminal justice system. and the system itself, the prosecutors, the defense counsel, the judges, and the officers themselves. Do you aspire to strengthen the integration of mental health into that fuller criminal justice system?
I think we have to. I don't. No longer can we actually ignore it, because when I think about the last couple of times I've served as chief, there in Metro Atlanta, DeKalb County, and even going back to Rochester, New York, we had, even back in 2005, I developed a program for that city that mimics very much what you do today. And it was much more targeted, much more specific. We kept data, and we had great data on the work that we were doing. But of course, when you have changes in mayoral administrations, it lost itself over the course of years. And to their chagrin, it had not benefited them to put that document aside, because they ran into a number of problems in dealing with people with mental health that probably could have been avoided had they maintained that training, in which I had introduced as a psychologist with the help of my colleagues at the University of Rochester, NAMI there in Rochester, and a host of other community contributors. But yes, we have to, in 21st century policing today, the world is much more convoluted and it's much more complex than it ever has been before. We know through the literature that a great deal of calls for service that we respond to today have some mental health component to it. Whether it's drugs, alcohol, depression, which is a leading cause of mental health in this country, or some type of psychotic episode, or whatever the case may happen to be, a great number of calls we respond to has that component in and around it somewhere. And any correctional institution, whether it's here in Hennepin County or anywhere else, will tell you the greatest number of their populations they have incarcerated at this very moment are people who have mental health issues that are going on in their life. And we arrest these people, we incarcerate them, we put them in jail, but they never receive the type of support that they need in order to work through these mental health issues. Some of them may be more organic than others. Some of them may be more environmental. But the fact of the matter is, since the deinstitutionalization of mental health patients across this country in the past 30 years, because of onset of new SSRIs and et cetera, what we have seen is that when people left these institutions, they were put out on the street with prescriptions, but they did not have a support system. And when you don't have a support system in place, then you're going to end up a lot of what we see in homelessness, which we know characteristically about 70–80% of the homeless population struggle with some mental illness. That is a huge number, and it seems to be growing. Homelessness seems to be growing across this country for a variety of social reasons that now police has absolutely no control over, and police is least trained to interact with people who are suffering with these mental health conditions. And when you have people who are struggling with mental health, and when you have police departments oftentimes that are undertrained to engage this population, oftentimes we've seen the outcome as to not being very good. And it's not to the benefit of that person who's struggling with mental illness, and neither has it been to the benefit of police departments or that officers who had to engage and either use too little force or they use too much force, and then we're off to the races. And we got to fix that, because what we're doing, we're sending oftentimes across this country police officers out to do a job that oftentimes they have the least amount of training for. And that is not right. And we got to do a better job at that.
Norm Ornstein?
Yeah, you've raised so many important points. We know that more police officers die by suicide than in the line of duty every year, that there are serious mental health issues that have to be dealt with. And we have to find ways of doing it outside of departments so that there's no stigma and other issues that can be attached to them. We know that the three largest facilities of dealing with mental health are in the country are the Los Angeles County Jail, the Cook County Jail, and Rikers Island, all of which we're also going to have to deal with. You've raised some issues about the training of police officers, and I'd like to follow up in a couple of ways. One is we know that generally police officers are trained to escalate. If you're issued a command, it has to be followed, and if it isn't, you escalate the conflict. What are the ways, crisis intervention team policing being one, that we can move people to de-escalate more? But I also want to ask you if we have a broken system when we recruit people into departments of making sure that we have the right people and that we're not bringing in people who are going to themselves create more problems. And are there ways at the initial stages of training new recruits to perhaps build in a different way of looking at policing? And can you do something about that here in Minneapolis?
So let's start with the recruitment aspect of young people coming into policing today. First of all, let me note that across this country, attempts to recruit young people to come into the profession, particularly Generation Z, if you will, they have very little interest in being police officers. The recruitment efforts across this country now are humongous. Minneapolis lost 200-300 officers in 2021, right after the riots. They went from 800 officers approximately down to where we are now, about 550. That is a huge, significant loss of police officers in a city that's the size of Minneapolis. And so now we're in the process of trying to come up, like every other city in America, whether Chicago, Philadelphia, you name it, everybody is struggling now to recruit. But that's going to be an ongoing effort, and we're probably not going to see those 200 or 300 officers back anytime during the course of my career here or anyone else, to be perfectly honest with you, because it's trending a very different way now. So what does that mean? It means that we're going to have to learn how to, across this country, police differently, and we're going to have to supplant those losses with something else. And my idea of supplanting those losses with something else are two things I think we have to consider. One, we're going to have to introduce new technology. I'm going to get to the mental health part here in a second. We're going to have to introduce new technology into a policing. And there's a lot of technology out there that can be useful in terms of crime fighting. Number two, equally as important, if not more important, we got to continue to develop in these relationships in communities, because there is where you get the force multiplier. Yeah. When you have people in the community that see their agency as being legitimate, they see them as being trustworthy, they have real, genuine relationships with their community police officers, and it's not this proverbial coffee and a cop. That is not going to suffice. It sounds great, but it really has no real substance to it. You really have to have relationships in communities now that are sustainable, they're genuine, they're original. Everybody understands it. For their own public safety, we all have to work together, and we all have to meet and talk about these things together. We also have to create strategies with our community members today. We can no longer, as police executives, isolate ourselves and work in a silo and tell you how I'm telling you how you should protect your community. That has to be a joint effort. You live in that community. You know what your needs are. So I need to be able to hear you, adjust my personnel and resources, no matter how limited that they are, around what your needs are in your community. And we have to be supportive of each other. In terms of recruiting young people today, the type of young men and women we need in departments today are young men and women who have the ability to embrace differences. That is number one. You have to be able to embrace differences. And many of our young people today, regardless of what age they are, many of them do because they grew up in a very different time. They've had all kinds of friends by the time they finish high school. And it doesn't matter whether they live in a rural area or urban area, suburban area. Because of social media, our children have friends that are around the globe that we don't even know about, even if they live in a very homogeneous community somewhere. But they have a variety of different friends that go to their schools, that go to their churches, that go to their synagogues. And merely because we all may appear to be of some specific ethnic group, there is diversity even within those groups. And we know that today, and we have to acknowledge that today, because you can't look out into a crowd and make the determination that everyone is the same. So young people have to have the ability to embrace difference. They have to be empathetic, and they have to respect humanity. Because in policing, it really is about preserving life. Because at any term, at any time that we have to use deadly force, that is a last option. That is the final option. That is not the first option that we come to. And in policing, we're changing. We're going to be forced to change because we're not going to see the numbers we used to see. Communities are holding policing a lot more accountable today than what they have in the past. People are asking questions. People are demanding answers. And we have to open up our agencies to the public so that they can see what we're doing inside. It cannot be some clandestine operation where, ooh, I don't want to ask the police how they do this or how they do that. No, what we encourage, what I've encouraged now, even our standard operating procedure manuals are put up online so that the general public can see what it is exactly what we do and how we do it, from wearing our hats to and how we conduct internal investigations to uniforms to you name it. These are your police departments. They don't belong to me as a chief or as a commissioner. They belong to the citizens in which we are serving. And those attitudes are changing. And the men and women, I think, that will come into this profession, not in high numbers, but those that do, they're going to see it very differently.
Dr. Alexander, we're running out of time, but I want to address a question I think is in the mind of a lot of folks in Minneapolis who've frankly lost trust in the police department, who see the department as the Minnesota Department of Human Rights in its report indicated was an institution with systemic racism. Mm-hmm. What will be the markers of change? How will you be able to demonstrate to so many folks in this town that there's real change and that the department is no longer racist? Because the idea of change in Minneapolis, it's not really believed in.
Yeah, so legitimacy becomes the question here. And if people across this country, in this community or any city, don't see their police department as being legitimate, then people are less likely to respect you and to do whatever it is that you ask of them, because they don't see you or feel you as being a legitimate organization. Even though you have been given them the authority by the state of Minnesota or any state across this country, you've been given the authority and the power to take people's freedom away from them, and even to take a life away from someone if it's justifiable. You have that kind of authority. You have that kind of power, but it means nothing if the people in which you serve don't see you as being legitimate. I can go to the best school in the country, University of Minnesota. I can go to the greatest medical school in this country, right here at this great university, right here at this great institution. Receive all the greatest credentials that you can ever receive to be recognized as the finest neurosurgeon in the world. But if those patients and people don't see me as being legitimate, my skills won't mean anything to anyone.
Are there specific indicators, or how will people know that?
Yeah, you know, how they will know that is going to be over time. I think that's going to be determined, quite frankly, about how we move forward, how we develop and create new leadership. I mean, not new leadership, but relationships across our communities, how we develop our mental health program, how we engage communities in a very genuine and authentic kind of way. Those attitudes will change. But let's be realistic about something. Racism is alive and well in every institution in this country. Every institution. It's not just relegated to public safety. It's across all domains. So it's a huge problem. It's a big problem, but we all have a responsibility to work towards it. But are we going to ever get it to zero? Probably not in my lifetime, probably not in yours too. But those of us who are responsible citizens, those of us who are responsible academics, those of us who are responsible in whatever endeavor of life you're involved in as citizens, whatever, we have a responsibility to be able to share, be able to be respectful, be able to be understanding to differences that are around us, because guess what? These differences aren't going anywhere. They're not. In fact, they're going to expand. And all the differences that we have right here in this great country of ours, nobody is leaving. Black folks ain't leaving. White folks ain't leaving. LGBT ain't leaving. Catholic and Jews aren't leaving. Everybody is going to be right here. Because that is truly the essence of what really makes us a great country and a great democracy. But to your question, the changes are going to be in the way that we treat each other, in the way that we respond. And it's going to be hard to measure, but people will tell us over time that we're doing things better. They feel more respected. Procedural justice, which I won't get into now, plays a significant part in terms of how I deliver service to people in the community. But we have a lot of work to do in Minneapolis, because this is a community that, quite frankly, and not just in North Minneapolis or South Minneapolis, but throughout this entire city, there are a number of people who are unable to, at this very moment, see their police department as being legitimate or trustworthy. Part of my mission, part of the mission of public safety, in which I have been assigned to and take responsibility for, is to help build those relationships, create an environment in which people begin to see their public safety very differently, get our men and women trained, hold them accountable and responsible for their actions, but more importantly, to role model to the leadership, whether it's the chief of police or the fire chief or whomever, for me to role model to them what I expect for them to role model to their command staff, which I expect for them to role model to the very last person hired in their respective agency. That's how we change it, a little bit at a time. But at this very place that this city is in at this very moment, we really don't have anywhere to go but up, quite frankly. And to be honest with you, you have a lot of naysayers in your community. You got a lot of people in this community that also find value in us being stuck. They find value in it that benefits them, but it does not benefit this overall community. And I will call it out when I see it, because I'm not going to run from it. You confront me, and you confront these agencies that are trying to do better, you're going to get confrontation back, because we can no longer just sit on the sideline, let people say whatever they want to say. That does not grow your organization, doesn't grow your city. It serves no value. It's full of negativity and nastiness. There's no place for that. And if we stand by and don't say something or push back to it, then we're complicit. And I didn't come 1,200 miles from Florida to come here and be complicit. I didn't come here not to do nothing. I could have stayed home and did nothing. So I'm committed to the challenge here, but I need this entire community to be committed to the challenge, because we do have a challenge in front of us. But I'm confident that the men and women in public safety, whether in police or fire, emergency management, wherever, people have the ability and the capacity to do better, and we're going to do better.
Dr. Cedric Alexander, unfortunately, we've run out of time. It was a very powerful statement. And I want you to know, throughout this community, there's hope for you and the leadership you're providing. There are going to be the naysayers, but the vast majority of citizens and people in public life are pulling for you. So you are not alone in this. There are a lot of people who know there's only one place to go, and it's up. And I think you've put it well. So thank you very much for joining us.
Thank you for having me.
We look forward to seeing you.
Thank you very much. Thank you.
We're now going to have our second panel. They're going to quickly jog up here, and we'll get started in a moment. Thank you very much for being with us. We now have a second panel that's going to focus a little more directly on the issue of policing and mental health. And we've got a tremendous panel here. And I want to start with, I'll just go down the line here. Senator Draheim, excuse me. Senator Ron Latz, Judge Leifman, and Dan Gillison, who is the president of the National Association on Mental Health. Judge Leifman is a renowned judge in Florida who's been one of the leaders in the country on looking for ways to integrate mental health and policing, and has been very successful in that. Chief Kelly McCarthy, who's from Mendota Heights. She's also one of the leaders here in Minnesota from what's known as the Post Board, which sets the standards for policing and has been a tremendous force there and elsewhere. Mindy Grayling, who has been an author. She was also a state legislator and quite influential on mental health and a number of other issues. And my co-organizer, Norm Ornstein, who is a well-known Washington innovator and has also taken up mental health and policing as his calling. Norm Ornstein.
Thanks, Larry, and thank you for all that you do and for convening this session. We're going to have a broad-ranging conversation, I hope, about how we can change the system in ways that Chief Alexander just so eloquently talked about from his perspective. And here we have a group of people, both those from this area, legislators who've been working in the trenches on this, Steve Leifman, who has remarkably transformed the way that Miami-Dade County, one of the handful of largest counties in America and an extraordinarily diverse place, has been able to transform the way the criminal justice system and policing deal with those with serious mental illness. Dan Gillison, the president of the National Alliance on Mental Illness, which is the largest and most significant organization dealing with all of the issues of mental illness, including encounters with the criminal justice system. And of course, Chief McCarthy and Mindy Grayling, a longtime legislator who has her own personal experiences I have had with the broken mental health care system. So let me just start by asking the Minnesotans, what's working here? What's been done well? What's been done well at the local level that somehow has not translated to the statewide level? What do we have at the statewide level that simply hasn't filtered down to the local level? And then we can talk about what isn't working and what we can do to fix it. So let me start at the end with Senator Draheim.
Thank you. I think what we've tried to tackle this last year in the Senate was really two things, and this will bleed into your question a little bit. One is access and professionals. And where you have access and where you have professionals, there's a lot of pockets where it's working. The problem is we don't have the capacity And when you talk to in my area, the sheriffs, because I'm more rural, their jails are 3/4 full, even though they would wish they could, not wish, that's probably the wrong word. They normally would have more people in jail. They cannot fit more people in there because they do not have the personnel, cannot hire and retain the personnel to work in the jails. And a lot of people quit because of the people with mental health problems that endanger the staff, and there's nowhere to put them. So I guess that's what I look at, where we find the professionals, and there you have little pockets of working programs, but we don't have the capacity.
Thank you. Senator Ron Latz.
Well, we're blessed in Minnesota to have a lot of well-trained mental health professionals, community activists around these issues, community resources in a lot of communities. But and so we've got a minimal level of resources. But over the years, and especially since we deinstitutionalized the mental health system in the 80s, we let people out of the institutions, but we didn't have the community-based settings for them in place to deal with the population. And we still don't have that. We have lots of community services available. We have lots of group homes available, but we have neighborhood resistance to placing group homes on their streets or their blocks or within 3 or 4 blocks of their houses. There are density requirements and distance requirements. So there are barriers. There's insufficient capacity because we haven't devoted the resources to building out the system that's necessary. So lots of good people. We have a lot of knowledge. We need to devote the resources, and it needs to be coordinated in a collaborative way so that when it's built out, we aren't leaving these pockets, we aren't leaving these gaps, and we're reaching all the people that need the help and can substantially reduce our the jail needs for people with mental health issues rather than really criminal conduct issues.
Chief McCarthy.
Thank you. And thank you so much for allowing me to be here today. I feel like before we go too much further, we need to acknowledge that there's 2 big forces that are intersecting here that we're not really talking about. And thank you for bringing up just systematic racism. And that casts a shadow over everything we do. But so does our culture of gun violence. And from a law enforcement perspective, we have to look at how all of these intersect. And I think the question was, what are we doing that's working? And what we did in Dakota County is, as law enforcement professionals, we got together and we realized it is infinitely better to call a plumber than somebody who knows how to fix a leak when there's something wrong with your sink. Officers, and here's something we don't want to talk about, we're really well trained at de-escalation. We're really good at it. We're not consistent. Everybody in this room can think of a time that you saw police officers de-escalate a white person and maybe overreact when the person we were dealing with didn't look like us. We are very well trained at de-escalation. And so we realized that sometimes just our presence can escalate, and we're not always the best people and I know my police ego, thank me for my service, to say that we're not the best people to respond all the time, but we realized that. And so what we did in Dakota County is we came up with a consensus document, and we told the county social services, we acknowledge you're better at this than we are. What can we do to support you? And between that and Travis's law, we were able to create essentially that diversion program at our dispatch center. And so of the 800 and some mental health calls that have come in the past 9 months, we were able to reduce police response to those calls by 79%. That's hundreds of calls that historically police officers would have gone to by themselves or with a co-responder. And we're really pushing to that no responder model. And so that has been a great success and something that I'm very proud of in Dakota County, and for Dakota County Community Services. They've done a great job.
Mindy Rowley.
I think what our mental health system in Minnesota does best is accommodate people who are voluntary, people who know they have a mental illness and they seek help. Then the world is open to you. So that is the flip side of Matthew Ornstein, who had anosognosia, which my son has had as well. People who don't think they're sick, don't want to accept care. That's something we can talk about when we're not on the question of what works well. And then we have in Minnesota 4 very fine working mental health courts in the 3 biggest counties, and then one that's a consortium on the Iron Range. So for people who live there and for people where the court hasn't reached capacity, so they can't take everybody, which happened to my son, where then he ended up in felony court instead. Those are things that are working well.
Let me, we're going to come back to what's not working a little bit more. And obviously, one of the things that we know is you can have component parts that work well, but if you don't integrate them into a broader system of care, it's not going to do much for you. I've heard story after story from around the country where you have police who respond in exactly the right way to a mental health crisis, know that they have somebody who needs to get help, and there's no bed, there's no place to go. Or you go to the emergency room where you're going to have to sit as a police officer for hours off your job to take care of it, and the only other option is jail. So we need to talk more about comprehensive care and treatment. And with that, let me ask Judge Steve Leifman, who's had 22 years of trying to pull together all of these elements, what you were able to do and how you were able to do it, and how, knowing that there are many things that do work well in this state and at the local level, there can be lessons drawn.
Sure. And thank you so much for allowing me to be here. I'm half Minnesotan, so I feel like I'm home. My dad was born here and grew up here, so it's a real pleasure. Now, I think the first thing, it's good to be judge. And when we invite people to meetings, they come even if they don't want to be here or be there. And that's how we started, with a mapping in my own community where, I invited all the traditional and non-traditional stakeholders in our community. And we sat down for a 2-day summit, and we literally mapped out the intersection between the criminal justice system and the civil justice system and the community mental health system. And what we found is that we were frankly embarrassingly dysfunctional. And we were really good about not pointing fingers. This isn't one person or party or institution's fault, and not one person or party or institution is going to fix it. It truly requires a collaboration and a certain level of trust and respect among the stakeholders. And we had very little resources in Florida. We still do. We do not have expanded Medicaid. We're 49th or 50th per capita in funding. And so we were really forced to have to work with each other to be able to make some structural changes. And the summit wasn't put together to, create a mental health court. That's kind of a small, minor thing that really doesn't fix the whole thing. We really wanted to see, how do we make a structural change to be able to make a real dent in the problem? And, what we realized after we finished this mapping is that us so-called healthy, sane people were the sick people that had designed a system to fail perfectly, and it failed perfectly. And that we were part of the problem. And everything from the way we handled competency restoration to the way law enforcement intersected with individuals with these issues to the way the courts identified and treated people with these illnesses. And so we decided we needed a 2-part approach. And if I had to do it again, I would do a 3-part approach. But the 2 parts that we took on were a pre-arrest diversion system and a post-arrest diversion system. And we've become more sophisticated and are trying to move more towards what Chief McCarthy's talking about, not even having a law enforcement response when you don't, because We didn't have data 22 years ago, but the data now shows us that police really only are needed in about 7% of mental health calls. And it was fascinating to hear the new chief, they have a recruiting problem. Well, why are you using your police to handle so many mental health calls? You could probably do with less officers if you didn't have to do that. In Florida, more than half of the civil commitments are done by law enforcement. In fact, in Florida, and this is nationally, I'm sure, our police handle more mental health calls than burglary, assaults, and auto thefts combined. And those are a lot of cases. It's 106,000 cases a year. And so we're not using our law enforcement resources, stressing them out more, stretching them out more as well. And so we've been able to really try to change how we've approached that. And it's worked. We keep a lot of data, and out of, we looked at the two largest agencies. We now have all 36 departments trained. And out of 105,000 mental health calls over a 10-year period, the last 10 years, our two largest departments only made 198 arrests. And so the number of arrests in Miami went down from about 118,000 a year to 53,000 before COVID. And our jail audit went from about 7,400 to 4,400. And we closed the jail. I mean, you want to get your county to love you? Save them money. And a lot of what you talk about is not cost savings, it's cost shifting, which is important. But when you actually close a jail, it became a cost savings. And for us, it was 12 million a year. It's 96 million in real savings. And to my county's credit, they have reinvested a lot of those dollars back into building a better mental health system, which they're not responsible for, my state is. But they're still spending so much money in the jail for this population. They've realized that by doing smarter, better things, it'll save them money in the long term. So we also set up a post-arrest diversion system. So now that if you do get arrested in Miami-Dade on a misdemeanor with a serious mental illness, you're basically out of jail within 3 days. You're transferred to the civil system, and we give you an opportunity to come into our program. And if you agree to go, we do not rebook you. We take you right to court. And we haven't talked about peers enough, because that's a really great way to save a lot of money and also to get much better outcomes. We have 8 of our 24 member staff are people with lived experiences. Many of them graduated from our program, and they help this population not only navigate the system, but also reestablish relationships. People don't appreciate, but by the time you get arrested with a serious mental illness, you have clinical depression on top of your mental illness. The system is just beating the crap out of you. And it's not that you don't want to take medication. You don't care if you breathe. And so the peers are really great about helping break down those barriers to help people want to get better. And so we now have a diversion system post-arrest for both misdemeanors and felonies. And it works. Our recidivism came down from about 72% to 20%, which got our state attorney's attention and bought in. And, if you really want to improve public safety, get people treatment. It's not rocket science. And then help them navigate a very complex system.
Great. Dan Gillison?
Well, first of all, thank you for this convening, and just appreciate the opportunity to be here on behalf of NAMI, the National Alliance on Mental Illness, and to you, Larry, and to you, Norm. Thank you for doing this, and Mindy and Sue and Mindy was on the board of NAMI, and it's about leadership. It's about leadership, tone, and execution. And I think that there are some things that we have to look at in terms of what we're doing in terms of that execution from the standpoint of, we know our person, and Chief, thank you very much for what you're doing in terms of your leadership, because you recognize that a person that's having a mental health crisis deserves a mental health response, not a law enforcement response. Judge, what you just talked about in terms of peers, going down to see the Miami model years ago, I met one of those peer specialists, Justin Volpe. And if you've seen the documentary Definition of Insanity, you'll see Justin in his role. And he is so well received because he's got lived experience. And to all of you all that are here in the room with us, and also in the virtual room, thank you for what you do in terms of addressing this. NAMI is an organization that was started by mothers 43 years ago. whose sons were diagnosed and assessed with schizophrenia. And from 43 years to now, we are the largest grassroots organization doing work in communities across the country, in the communities where we understand the DNA and we're a part of it. What we all are on is this treadmill, and we're all going so fast that sometimes sometimes you gotta slow down to go fast. And what I mean by that is you gotta look at, well, what is it that you're, as you talked about the counties and the rural counties, and then we go to the cities and the states. The net is, what are you doing well that you can build on? Because you don't want to, as you're trying to bring in new opportunities and new solutions in the front door, you don't want to throw those things that are going well. You want to build on them. So how do you do that? One of the things we're looking at is something that you have here, your mobile crisis response across over, I think, in every county that you have here. They're all not funded, but they're up and running. We have 988. Which is the new national suicide prevention and mental health crisis number. And 988 has been in place since July 16th, so it's almost a month now. But the point in fact is that is where we're talking about reimagining crisis response and building a continuum of care. Someone who is answering the call, someone who can be dispatched if the situation cannot be de-escalated, if you will, and then a place to take them, a place that is very receptive. And that is something that we're looking at in terms of our body of work and making sure that we're doing this in the best way. The other thing that we've done is a series that we called Help, Not Handcuffs. A person with a mental illness deserves help, not handcuffs. And we did a series of sessions where we talked about, and we brought experts together to do this. And on behalf of the Matthew Harris Ornstein Foundation, they kicked it off for us in that very first panel. That was our largest one. We had over 4,200 people register for that session. The next one was on legislation and community needs. And the last one was on community models, because we wanted to move from leadership to tone to the community models execution. If someone's there in one of those webinars and they want to understand, how do I do that for my community? We wanted to end that series with, here are models that are working. Here are some best practices. No one wants to be a guinea pig. A lot of people will go with a pilot, but they need proof sources. So we want to be a part of the solution, and we're very happy to be here. And we know it's about convenings, and we know it's about conversations, and we know it's about collaboration. So we appreciate being a part of this.
Norm Ornstein, thank you. Norm Ornstein, I want to ask you, you've worked in so many different policy areas. This one strikes me as one of the most daunting, and you've dealt with a lot of daunting ones. You've got the convergence of three, I'll use the word disasters. You've got a mental health system that has tremendous need on it, but is overwhelmed. You've got a criminal justice system that has lost a lot of credibility, a lot of questions about it, issues around racism and fairness, and also its sheer operation. And then you've got a police force, which, as Dr. Alexander said a moment ago, has only got up to go, because in Minnesota, it's taken such a hit in terms of its reputation. What is the path out of the convergence, this really nightmare convergence?
It's daunting and frustrating. One of the things that's frustrating to me is there isn't a family in America, I would say, that hasn't been touched in some way by brain diseases and mental illness. And yet we have other diseases that have enormously powerful lobbies with many fewer people who have been touched, that manage to succeed in getting funding and finding ways to do better research and to implement change. And we don't have that. NAMI's done its best, but the fact is stigma still is significant. When I first went public with what happened with our son, with a piece in the New York Times, I got flooded with calls. I still do. My wife does. And almost all of them are, I've never told anybody this, but. And we're starting to overcome it, but that's certainly a part of the problem. We know that also is something we've discussed over and over again in the mental health system. When we deinstitutionalized, the promise that we would replace these institutions with community health centers with beds never happened. We've lost 90% plus of the beds that we had. It was something we were talking about earlier when Chief McCarthy was talking. If you do it the right way, but there's no place to take somebody, then you're going to end up back in a jail. So we know that we've got to create a different comprehensive system. One of the things we fought for over and over again is this terrible rule in the federal system that's called the IMD exclusion in Medicaid that limits community health centers to 16 beds and getting Medicaid funding for dealing with mental illness. And it's going to cost money, but the savings that come, what Steve Leifman has uncovered for people is if you do this the right way, you save huge amounts of money. You can save lives and save money at the same time. But it's also convincing politicians to put an initial seed resource into a system for a benefit that's going to come a little bit later. The same is true with training police. Now, I'm not going to tell you that crisis intervention team policing is itself a panacea. We know there are plenty of people who are trained, including in Minnesota, and we've had tragedies still occur, including from officers who've been trained in that de-escalation. But just as Chief McCarthy said, often they view it very differently through the lens of a person of color who's having a problem. And that's built into our system, I think, this sense of fear. And of course, if you're trained to respond with force, then you're going to get those tragedies. So it's a top to bottom kind of approach. And I would just mention one other thing, something that Steve's talked about a lot and that we also know. We're so siloed. We're siloed in terms of mental health with the hospital system and the way it deals with it, with the criminal justice system, with the prisons, with policing. But we're also siloed because something that's working well in one county, like Dakota County, doesn't get spread anywhere else. Dan Gillison worked with Steve and with others on a project for years to try and get counties to follow best practices. And there were a lot of resources put into that. And the fact is most counties still don't respond well. It's partly culture. They don't want to be told other things. They don't want to change what they've been doing. This, as you know, Larry, you and I who've worked in the political arena for so long, changing anything is difficult. Our system that's so decentralized. But what we have, I think, an opportunity here in Minnesota to do, because this is a state in the front lines, in the national spotlight for its failures, but it's a state with enormous resources. And now this is an opportunity. And I'm hoping that this is a kickoff for a different way of doing things, where we can pull together state leaders, including great state senators and representatives that we know understand these problems, knowing that they're as greater in rural areas as they are in the urban areas. In the rural areas, we have no help and none of the resources. You don't have psychiatrists you can go to. You don't have the beds or any of those things. That maybe we can find a model that actually can be repeated elsewhere. And this is the time.
Senator Droheim, I want to ask you about policing in the political world. And we'll just be real about this. There are few issues as polarizing as policing. You throw policing into the state capitol here in Minnesota or elsewhere, and people can easily run to corners, and they're different activists are very skilled at polarizing. Do you think the focus of mental health is a way in which we can kind of take a deep breath and deal with a core driver of some of the problems with policing or criminal justice system? Does it strike you that building an agenda around mental health is something that we can work on together across party lines?
I think we did that in the Senate this last year. We put together a package of very bipartisan bills that try to address some of the issues with the limited budget that we had. We've done bonding in the past for facilities, but they're all Band-Aids. I'm really proud of the mental health bill that we got passed this year and what we were able to do, but it's a drop in the bucket. And in my opinion, we need to start in school. We really need to teach our youth about policing, but we also need to teach our youth about coping skills and being open and talking to people when they're at crisis. And, you know, for me, it was sports. I was very active when I needed to have a release, if you will. I went out and ran or biked or played basketball or whatever it was. But that conversation about policing needs to start very young. And I know the DARE program is really popular in my area. But I think we have different perceptions depending on where you live. So in most of my new district of 7 counties, it's all sheriffs, you know, for the most part. And if you have a police force, it's probably 3 people, which is a lot different than what Senator Latz has in his district. So we have to remember that there isn't a one size fits all. But I think we have to have that conversation in an adult fashion. And I think that's what's missing in politics, is that it's hard. Not everybody is as level-headed as Senator Latz here. And we're on the opposite end of the spectrum, but we can have a conversation. And that's what we should ask of all of our elected officials, is to have that adult conversation and remember what's the goal. And here it is, to help people. Alls I hear in district, sheriffs are overwhelmed with mental health problems. The hospitals are overwhelmed with patients, and they have nowhere to put them. Both of them have nowhere to go. And that's why we worked so hard this year to get something done. Was it enough? No. I'm hoping that we can dedicate a whole committee to mental health moving forward in the Senate, because we haven't done that the 6 years I've been in, and really try to have a game plan. Do we need a regional center for congressional seat or congressional district? Because Olmsted County, you know, they were able to get some body money and put up a facility. You know, I think they're definitely headed in the right direction. But that's nice for Southwest Minnesota. But what about Northeast Minnesota or wherever it is? So it's just keeping the conversation going. And in my area, the policing isn't as big a deal.
Thank you very much, Senator Latz.
Well, it certainly is an issue across the state. And I agree with Senator Drahan that it's important to get to the kids early. Part of that's a function of resources. We have, I think now we are 50th out of 50 states in the ratio of counselors in the schools to students. We have so few counselors. They can't begin to provide the services and resources, even identifying students that are having mental health issues, wherever they're coming from, you know, issues at home, food insecurity, trouble with classmates, peer conflict, whatever it is. We don't have enough counselors in the schools to be able to even begin to crack that problem. You know, gun violence was brought up, and we've got, you know, the gun violence by suicide in rural Minnesota is the greatest cause of death by firearm in greater Minnesota. It's in the metro area, it's a little bit different, but it's suicide, which is a function of depression and other mental health issues, is a terrible problem in greater Minnesota. That in part, again, comes back to resources. When you've got the police bring someone to the hospital and the hospital admits them into the emergency room, and then the hospital doesn't have any beds out of the emergency room. They've got no place to discharge them to in the community. And so we got stories now, people are staying in emergency rooms for 30 days or longer because there's nowhere else to put them. The jails don't even have the capacity to put them in the jails in many cases. And I think part of the issue is as we come together as communities, we have institutional inertia, we have bureaucratic inertia. People want to protect their budgets, they want to protect their jobs, they want to protect, you know, what they're doing. They believe in their mission, even sometimes when the mission becomes a little bit outdated or needs some substantial tinkering. But in the end, and this goes especially for the folks that tend to be targeted with complaints or criticisms, everyone has to be willing to be not so defensive and to view themselves as part of the solution to the problem and to be proactive about it. And I'm thinking not only in terms of the mental health professionals and the institutions and so on, but certainly within law enforcement, target of a ton of criticism. Law enforcement is also critical as a part of the solution to this issue. And they have to be willing to be less defensive, maybe be a little more empathetic, see the world from not only their own perspective, but other perspectives, and buy into being a part of the solution. When we're all at the table trying to do it that way, and that includes the legislature, we have to be willing to buy in and not to polarize and politicize and retreat into our corners and take advantage of issues that it's easy to throw rhetorical bombs or political bombs across the aisle, especially in an election year, and not come together and find the solutions and compromise to make progress. We all have to buy in to solving this problem and not just perpetuating it.
I've got a bunch of questions here from our audience here and the audience online. So let me get to as many as we can. Chief McCarthy, you mentioned Dakota County, that mental health professionals were being given calls that were coming in that would normally go to the police department. Is that being done elsewhere in Minnesota?
Yes. Thank you for the question. And as much as I hate to say anything nice about elected officials, and especially statewide elected officials, the legislature really should take a bit of a victory lap on that, because what we're doing in Dakota County is a direct result of you all changing the use of force statute and scaring some members of law enforcement into changing. And then also community activists should really be proud of themselves with the passage of Travis's law. And so that was passed, and you gentlemen probably remember better than I do, but it now requires PSAPs or dispatch centers to divert calls to mobile crisis units if the mobile crisis units are able. And that's always that if is where the pinch point usually is.
Thank you. Dan Gillison, question here. How do we recruit and encourage people to become mental health professionals?
It's an incredible question. It's a very good question. If you think about all of us as aunts, uncles, mothers, dads, and as we raise young people, think about what our young people are exposed to from the standpoint of the medical professions. We take them to an ear, nose, and throat specialist. We take them to a pediatrician. If they're an athlete and get injured, we take them to an orthopedic surgeon. We take them to the dentist. So they're exposed to all of these fields. So we have to go upstream, and we have to get people into the professions and exposed to the professions early. And that is through the American Psychiatric Association, American Psychological Association, as well as the National Association of Social Workers. And they do have early programs to bring people into the pipeline, if you will, get young people exposed to it. I think we should also look at our associate degree programs at our community colleges to get people in. The community colleges is a very good place for us to bring young people into the profession. And then we also have to create mentorship programs where, we do all these commercials on TV. We need to find ways to advertise and market this profession as a very noble and caring profession so that we can have other people come into the profession.
Larry, let me just add to that. This is a problem generally, and we're going to have a bigger problem in the healthcare system post-COVID as we're seeing so many people leave after all the stresses that they face, nurses especially. But it's a particular problem for serious mental illness. Most psychiatrists don't want to treat people with serious mental illness. They want somebody who comes in at 10 o'clock precisely, stays for 45 minutes complaining about a spouse or kids or a job, leaves, and then pays. And my son could no more have made it to an appointment at 10 o'clock. And those who are willing often know nothing about the legal system or how to navigate through this process. We need to change the incentives as well to bring people in and to train psychiatric nurses and psychiatrists in dealing with serious mental illness and get it paid for as well. So it's a big challenge for the society. And with COVID, we're going to have a huge increase in people who have mental illness crises, including a substantial increase in schizophrenia, as well as depression and all these other things. This problem is going to get worse before it gets better, and we better mobilize now.
Larry, can I just add one
Yes,
thing real
Senator
quick to that? We, in our bill this year, we tried to address some of that with obviously some grants, but also on the supervision part of getting licensed. We wanted to reimburse the people that are supervising the new people coming into the field, so we can encourage them to get through and get into the field, because a lot of people start but don't finish. So we are trying to identify those things and trying to fund it at a minimal level, but at least we're headed down that path.
We've got a question here about 988. This is a new phone number for folks who are suffering severe mental illness and suicidal ideations. The question is about the wariness and distrust of this system and the fear that it's still going to funnel people into the police system, into the court system. Question, what criteria is going to be used for determining if and when to hand a case over to law enforcement, and how's that done? Chief McCarthy, any idea on that?
That's a great question. And I don't know is the short answer. We know that what we're trying to do is, and what we've agreed on as chiefs in Dakota County, is that police should respond only when there is a violation of the law or a suspected violation of the law, a weapon is involved, or somebody is threatening harm. And that if those criteria aren't met, we do not want to go. I would hope that wherever in the universe this 998 goes, when it gets to our dispatch center, it will, we will follow those criteria as well.
Norm Ornstein, I wouldn't describe you as an overly optimistic person by I don't know, maybe not by nature, but by training, and experience. How optimistic are you about 988, at least in the short term?
I'm very concerned. I think we've gotten out ahead of our skis on this. We need to have, first of all, trained professionals who will answer these calls. And we don't have the trained professionals. A lot of them are going to be diverted back to 911. One of the great things that Judge Leifman has done in Miami is he's trained the 911 operators to know when there's a particular mental health crisis, which teams of people to send out. And I think we've raised expectations about what 988 can do before we're ready to make it work. And I really fear that we're going to have some bad things that will happen that will scare people off even more.
988 is so critical to the seriously mental ill and many in the NAMI community. So we're very interested in seeing it operationalized in its best way. And we know that there are some things that need to work in terms of upfront. It is that certified counselor that is taking the call that's been trained. And the only time that they are supposed to engage law enforcement if there's a threat of harm. So there's a significant amount of training that they're going through before they can even take the calls. And then part of that is for them to know how to go through a filtering process to know whether there's a threat of harm. And then law enforcement is involved or law enforcement will not be involved. The biggest thing is the workforce. Is that we need more and that we don't have the workforce. So that's part of the challenge with 988 right now.
Thank you, Dan Gilson. Mindy.
One thing I'm going to be looking for with 988 that I'm hoping is better than 911 is that one of the early questions is not if it's a family member like me calling, is your family member voluntary? Because that kind of stifles things when you call 911. If the person is not voluntary, then you have to meet that standard that Chief McCarthy just talked about, or they say there's nothing they could do. They could come out and assess, but then if they don't meet that criteria, they would have to leave again, which isn't very helpful because then the person is even more upset and the family is left with them. Excuse me. So I'm going to be interested in watching to see if 988 is better than 911. In other words, they don't have that standard. They could send out a mental health professional, who could be more helpful and try really hard to get the person engaged and not just say they don't meet criteria, there's nothing we can do.
Norm Ornstein, we've got a question here from one of our online friends who is impressed by the work that Judge Leifman has done in Miami-Dade and is wondering, what are the next steps to bring a program like that to Minnesota? Would you recommend that a judge, as we saw with Miami-Dade and Judge Leifman, be a leader of that? And how do you cut across the various silos in the mental health system and criminal justice?
Before we're done, I also want Judge Leifman to talk about what he's doing next. He's building a remarkable facility that will be, I think, a model for the rest of the country. You do need a champion. This isn't going to work unless you have a tireless champion willing to pull the stakeholders together and keep their feet to the fire. That's what Judge Leifman has done. We need to find that champion or set of champions in Minnesota. I think it's helpful if they come from the judiciary, but they don't only have to come from the judiciary. I was so heartened by Chief Alexander, who I think has his finger on a number of issues and problems and is obviously candid about it. You see great policing done by people like Chief McCarthy. We had a police chief from St. Cloud, who's just a remarkable figure as well. And we just have to do this tirelessly. And I think, to me, what is most hopeful now is the desire has to be here in this state. You know, I'll tell you, as a Minnesotan, you know, around the country, I would proselytize about my home state, Minnesota nice, this incredible culture and all of that. George Floyd was like taking the rock off and seeing the dirty stuff underneath. And to know that, which we knew, I knew from our family, my family, Ron's family, grew up in North Minneapolis. All those problems were there for many, many decades. You put them behind a cloak of silence, in a sense, and now they're there and we see them. We're on the front lines in this state, and that a champion, I think, is going to find, because of so many good people in this state, the desire to make it better. And if we don't, then we're going to face some really severe consequences. We're already seeing some of it in this city, especially the crime, the fear of crime, the antagonistic relationships that have only grown. And that's what Steve was able to do, was to take antagonistic relationships and turn them into partnerships. Will we find those champions?
Steve Leifman, I'm sorry.
As you pass it to Steve, I just want to mention something, and this is more of a question, and I think it's important as in terms of my stewardship that I do it. I want to ask everyone really a question, and not to be answered, but when you hear these words, underrepresented, minimized, discounted, misunderstood, pushed aside, marginalized, invisible. When I first captured that, I was talking about those with mental illness, but I'd like to share this with you, as Norm mentioned George Floyd, and that I'll read the words again and then I'll pass it off to Steve. Underrepresented, minimized, discounted, misunderstood, pushed aside, marginalized, invisible. This that we're talking about in terms of those words is about building trust. And I just wanted to leave that with you from the standpoint of what's critically important is building trust, and for people not to feel marginalized or invisible or misunderstood or discounted or underrepresented. Thank you, Steve.
Sure. Judge Leifman, the Attorney General of Minnesota is here. He's ready for the next panel. So you have 2 minutes to close out.
I will never get in the way of the Attorney General. Thank you again. It is very scalable. Just last week, the Association of all the state chief justices met in Chicago, and most of their annual meeting was spent on mental health. And they passed a resolution endorsing this initiative and recognizing that every court in America needs to change. And they're putting an implementation plan together for the next 4 years on how to make it happen. So it is doable. But we have to remember that trauma is plays a significant role in this issue. And you mentioned doing something earlier, and I said at the beginning, if I had to do this again, there was 3 things that we should have done, not 2. And one of them is early childhood trauma. 92% of all the women in jails and prisons in the United States with serious mental illnesses have horrific histories of trauma, mostly sexual abuse when they were children. 75% of men who are in jail and prisons in the United States with serious mental illnesses also have horrific histories of trauma, sometimes sexual abuse, more likely to be victims of domestic violence, or witnesses to really horrible violence, just like a soldier would see in combat. Trauma is physiological, it's not emotional. It creates significant changes in brain activity, and there's treatment for it. We need to make sure that we identify it early and we help people get treated. Lastly, what you'll find is after you do all these great things, you're still going to be left with 20 to 30% of the population that are just too ill for this capacity that all of us have in every one of our communities. It's not a Minnesota problem, it's a national problem. And we talk a lot about crisis care, but then what happens to the individual after they leave crisis care? Just like diabetes or heart disease, it has to be maintained and treated. And so we're now building the first of its kind mental health diversion facility. It is a one-stop shop facility. Fortuitously or ironically, it is the old competency restoration facility in Miami. It's a 181,000 square foot facility, 7 stories. And what it's going to do is take all the essential elements of recovery and put them in one place, including primary care, dental care, eye care, podiatry care. It'll have a crisis stabilization unit, a short-term residential facility, a receiving facility. It'll have a day activity program run by people with mental illnesses to teach self-sufficiency, a culinary supportive employment program to help people get jobs when they leave us. It has a courtroom in the building so that we can manage both criminal and civil cases, and it has 200 beds of housing. And so the idea is, instead of just drop kicking people to the street once we've adjudicated their case, we can gently reintegrate them back in recovery with all the supports that they need to maintain it. And that you can do regionally in a state like Minnesota. You don't need one in every large, every community, and same for us in Florida. We need to regionalize it in our big rural areas as well. And so it will help all of us develop capacity. And you put in, telepsych, so that rural areas, they don't have to drive 3 hours to get treatment, but they can go to the local church maybe where there's a TV screen and they could see a psychiatrist. So there's things we can do. I strongly recommend that you develop these summits where you do these mappings in each community, so it works for what's in that community, not what's good for Minneapolis may not be good for your area, and same in my state. And if you start to do that, you get this buy-in. You don't point fingers, as I said earlier, and you give everyone else the credit for doing it. And that's
Thank you
how
very
it
much.
works.
That's a great way to send us off. I want to thank this phenomenal panel, Senator Draheim, Senator Ron Latz, Judge Leifman, who flew in from Florida, Dan Gillison, who flew in from DC, Washington, DC, Chief McCarthy, Mindy Grilling. Thank you very much. It's an amazing time.
Many stakeholders, what can you bring to the table? What are the big challenges that you face dealing with county attorneys, with all the different elements and stakeholders?
Well, Norm, we have some power and we have some influence. They're not the same. Influence is the bully pulpit, speaking up on the issue, writing about the issue, showing up when the issue is being discussed, telling people this is what we need to hear. This is what we need to do. And then there's power. I do regulate every charity in the state of Minnesota. We do a certain amount of criminal prosecution. In the state of Minnesota, the state law allows the county attorney to be the first line of criminal prosecution, except for in the area of Medicaid fraud. But we often get referrals and we do them. And the governor has a prerogative to hand us the case. That means we end up doing about 40 cases every few years, and they're serious cases. We also sit on sex trafficking commissions and task forces. We sit on gun task forces. We sit on violent crime task forces in a policy-making role. And so we have those two things together. Plus, we are members of the County Attorneys Association. And so we have both some power and some influence. And what I see, if we look at this thing as like a chain, imagine a person in a mental health crisis. They're going to be contacted by family. What resources do they have available? We have a good change in state law, which allows 911 dispatcher to be informed that this person's in a mental health crisis, and then to channel resources accordingly. Then you're going to have probably and then you have the police involved. What is their background and training? And are they aware of the resources available to them? And if you look at every police department in the state of Minnesota, are they up to the informational threshold where they know what they can do and what's available to them? Then after that, we got to figure out, what about our ERs? What about our direct service? And then we got to ask ourselves, where are our hospitals ready? Are our insurance providers ready? And then I think that it is important to have a discussion about something else, which is that we're not producing enough psychiatrists. We're not producing enough psychologists, social workers with a mental health background. We need more of those kind of people. And part of that has to do with reimbursement rates.
Yeah.
And then just to wrap up, a lot of our major mental health institutions, that hospitals and things like that, they are, even though in Minnesota they're nonprofits, they still are trying to make money. And this is not a remunerative area. So we've got to figure that out. And of course, I left out the jails, which are a critical part of this conversation. So we've got to intervene at every step one of those. I think that Sue Etter holds right. We don't need to rebuild the system. We need to build it. But we have everybody we need to tell us what we need to do. Now we just got to do it.
So just one question about your role. I was talking at one point with a former president of the University of Pennsylvania, it's appropriate here in a university setting, who said that her job was like being a caretaker at a cemetery. There were a lot of people beneath her, but nobody listened.
Yep.
And you have a lot of county attorneys.
Yep.
Do they listen?
I'm not their boss. Yeah. They are independently elected. But I will say that by and large, they're people who are responsible for delivering good outcomes with a limited budget to do it all. So they're open, They're looking for answers, the incentives are there, and we do have avenues for conversation. At one of our earlier meetings, Blair Anderson, chief in St. Cloud, made an interesting observation. So often when we're trying to figure out a problem, we don't always have everybody at the table to help deliver the outcomes that we need. Sometimes it's just an invitation, to say, what do you need to help us deliver this? So I would say that when it comes to the prosecutors, part of what we must do is, as we are developing this train of how we're going to manage this problem, is to include them and the sheriffs in the conversation, because the sheriffs run the jails. Prosecutors run do the criminal prosecutions. Look, the prosecutors are a diverse bunch, but they all care about victims and don't want frequent flyers. So I think that's where we are with it, but they've got to be a part of the conversation.
So the sheriffs that I've talked to don't want to be the repository of people with serious mental illness.
Right.
And we also know that among the employment crises we have are prison personnel. They're poorly paid.
Yep.
They're tough jobs. In some ways, it's a much worse career than a police officer, where we know already, and from what Dr. Alexander said, it was a big problem, that they don't have any of the resources that the police have, but they're dealing with a population where they're also trained to escalate if somebody doesn't obey commands.
Right.
Do you have this sense that sheriffs can be an important part of the solution here, because it would make their lives so much easier? Not to mention they have more resources if they didn't have as many people in jail.
Answer is absolutely yes. I mean, we did a thing that was wise to do, but we haven't really backed it up with what we need. What I mean is the initial screening for mental health when people enter the jail. So now You remember years ago, we had state mental health hospitals, and so a lot of those people were there. When we stopped doing that, people were out there on their own, but we weren't screening them. Now we screen them, so now we know a certain percentage is, both there on perhaps violation of a criminal law and mental health crisis. So but the question is, what are we doing about it, right? And and again, mental health is all you gotta factor in chemical dependency, CDMI, right? These things often come together. And so sheriffs are an essential part of this. The sheriffs have to deal with a lot of problems. They deal with people who are might need to get treatment right away. They deal with medical issues. They deal with people who have been found to be ineligible to stand trial because of mental health incapacitation, and yet there's no other place else to send them, right? So sheriffs have a handful of problems in this space, but I think that as a society, I don't know if we're listening to them well enough. They must be part of the conversation. They're a key player in this whole thing.
So one of the things that we've seen, you mentioned drug use. The vast majority of people with serious mental illness, especially those who have anosognosia and resist treatment,
Right.
Self-medicate with drugs.
Yep.
Our jails and prisons are filled with people because of mandatory minimum sentences and because of the way we've dealt with drug cases in the past.
Right.
What can we do about that?
Well, we've got to treat mental illness and chemical dependency as more of a medical problem, maybe even a social problem. But what we do is identify it as a moral failing and criminal conduct. And I think we've got to break with that. But let me just put one more complication in the mix. Neighbors, your average citizen, they're like, look, I don't know what's wrong with them, but they're creating a havoc in my neighborhood. Somebody come do something.
Yeah.
Now, the neighbors aren't saying do anything. They're saying do something, do the right thing, do what makes sense to do. So the fact that you have some folks, kind of maybe CDMI, maybe they're violating anti-panhandling statutes. They might be, stealing stuff, breaking stuff, public urination, all that. They might be violating some laws. Our answer is use that to criminalize them. Our answer needs to be a medical approach. And, interesting thing is that we have the capacity. We spend buckets of money if you look at it as an aggregation. What if we put some of it up front? We might save some on the back end. You've seen people save a penny and then waste a pound, right? You've seen us, spend money, say not do something on the front end that's cheap and end up spending a whole lot of money. Keep in mind, when they wanted to solve the budget crisis in Flint, they cut off the chemical that stopped the corrosion of the pipes. Oh yeah, we saved some money, and then caused $1 billion problem. So that's the nature of this too. We could save a lot of money if we just did that intervention early, stop viewing this as a moral failing or a criminal problem, and we need housing. And housing, everybody needs housing. People who are not in any way touched by the mental health crisis are in crisis when it comes to housing. So there are a few basic societal changes we got to make. We also got to get real about another very difficult moral / legal / social issue, and that is harm reduction. A lot of times, if you say we're going to allow you to use drugs in this zone, but you're going to have clean needles and safety in this is a moral outrage. People are ambivalent about it. They're not sure they want to do it. You're allowing them people to do this. How could you do that? Yeah, but if you don't let them do it, they're going to take the drugs anyway, and then they're going to give themselves serious illnesses, which are going to land them in the ER. We've got to have, dare I say, an adult conversation about harm reduction and get serious about how we manage that. Because until we have that kind of dialogue, we're going to keep creating some problems, I think.
You've raised a couple of things that have triggered me or concerned me. One certainly is that, as you talk about things like harm reduction, we're in a tribalized environment now. And so many of these issues end up being handled through a very different prism. If
Right.
you're for it, I've got to be against it.
Yep.
Or you just get these kind of rigid ideological views.
True.
Now, it's true that for a lot of the issues of reforming the mental health system, we actually have been able to bridge some of those gaps. But as you look at it from somebody who's been involved in politics in the state at different levels for so long, Minnesota has not been immune at all to these issues. How serious is that as a problem now in grappling with this broad array of problems like criminal justice policing and mental health?
I just want to say before I address that, you have been one of the best people at bipartisan dialogue. I mean, I hope y'all know that, you know, Norm in the state, in the District of Columbia is known to bring people together across that divide. We need to do it. Let me tell you, Norm, why I think that there's real hope for us. You know about the opioid litigation.
Yeah.
My office, the Attorney General's office, sued the opioid manufacturers, got, a amount of money for people, but then we needed the legislators to get involved to distribute it properly. And because we wouldn't talk to everybody, because we got everybody involved early, man, we passed the opioid bill in the last legislative session, a session where it didn't. I mean, the stuff that we actually passed, you could probably count on one hand. But we were able to do that. Why? Because we had representatives from the Republican caucus and the Democratic one, and we had senators and House members, all who came together to work together. Why did they do it? Because opioid addiction doesn't know party affiliation. And you got Republican members who've lost loved ones, you got Democratic members who've lost loved ones. We kind of figured out we got to do this. This issue holds the same kind of promise. What we've got to be able to do is have a long time. Once we get our proposed blueprint together, and you've been cautioning us, we don't want to just have an interesting conversation. We don't want to just identify a problem. We want to do something about it. So thank you for that. Once we get that plan tight, then the next thing we got to do is go sell it to everybody early so everybody can own it. And so once everybody owns it, we're going to minimize the political back and forth. On the issue of harm reduction, I really think we need to engage faith communities involved in this.
Yeah.
We got to have, churches, synagogues, mosques, temples, folks, not just the religious folks. Let's bring in the secular humanists too. Bring in the, I don't care, but the people who are motivated beyond just the material, if you know what I mean. And we've got to get those folks in the room to help facilitate this conversation. Because if you are a hardcore conservative Republican who has an addicted child, maybe, then they're going to go use, even if you say not to. you know that. You're not naive. You know what's up. That person who's been through that might be able to help their colleagues understand moralizing here won't get that person clean. We've got to do some other things. In town, there's a place called Teen Challenge. Politically, they're probably on the right side of the middle of the political divide. They're effective though. And they can help folks understand who are, might be inclined to resist something like harm reduction. They can get them to understand, why somebody might propose it. And it doesn't make that person a bad person for saying that maybe we should look at this. But that's the kind of thing I think we need to involve more people in the conversation, get it to them early, and we can bridge some of these partisan divides. As you know, I thought it was pretty partisan when I was there. From the looks of what's been going down on January 6th, it's worse now. But I'm still optimistic about where we can get because everybody loves their kids.
So you've had this great success with the opioid issue.
Mhm.
We know that there is a broad coalition for criminal justice reform.
Yep.
But it also foundered in the Senate this time for a variety of reasons. And it raises another, I think, quite delicate but really important issue, which is that the race issue has become even more polarizing. The use of the term critical race theory, which is driving a deeper wedge. We know that a lot of these issues end up being divided on partisan lines because of these terrible divisions on race.
Yeah.
What can we do about that, Keith?
Well, you know what? I'm glad you, first of all, let's point it out. You know, if you've ever noticed a conversation around race, you see Black and brown people talking explicitly about race, but everybody talks about race, not just explicitly, right? When people say this country has moved on and away from Americans like me, what are they saying? We all know, but we act like we don't know, but we know. Here's the thing. We have got to continue to be forthright about this kind of stuff, understanding that there's one thing about race in America. People, their natural inclination, in my opinion, is toward human solidarity. Yet it is an effective tool for demagoguery. If you really want to get in charge of something, start talking about how you're going to stand up for this group, which is long abused by those people. And there will be some people who will be like, yeah, we have got to have a much more deliberate movement toward multiracial democracy, inclusive democracy. We cannot allow people who would divide us to control the scene. We've got to be overt about it. And let me just also say this, and this is going to be slightly controversial, so I hope not to offend anyone. But I think that one of the problems here is that we all, and I mean white people, Black people, everybody people, we act like white people don't have problems, and yet they do. And so when we talk about racism, usually what we're saying is that this Black person suffered as a result of white racism. But the truth is, white men over 50, non-college, are dying from cirrhosis, opioids, and suicide. And we're not even talking about it because those people are not allowed to have problems. If they go to a psychologist, it's like, well, they suck it up, deal with it. What are you? I never dealt with that when I'm like, you know, and so how do they deal with it? Alcohol. I'm serious. Look at particularly in the middle of this pandemic, we have seen tremendous human suffering, but we don't talk to young white men who might be inclined to shoot up the school before they do it, because we live in a society where people like that don't have problems. Who has problems? Black people in the ghetto have problems. They have dysfunction. We're very all comfortable with that. But guess what? If you're human, we all have problems. Can we just agree that we all need a little bit of support and that it's okay and it doesn't make you less of a man or less of a this or less of a that? This is the problem that we're facing. It's not going to be easy. I would recommend to you a book that is called Dying of Whiteness by a guy named Metzel, Metlz. And he looks at a few different parts of the country. He looks at guns. Now, we all know that there's this huge gun divide in our country. I'm not here to jump into the middle of that right now. But what I am saying is that in the state of Missouri, when we said guns here, guns there, guns everywhere, have 2, have 3, have 20, have whatever you want, white male over 50 suicide shot up. Suicide may be the leading cause of gun-related death. Am I right? Can somebody fact check me on that?
Yeah, it is.
And who are the victims? You know what I mean? Why can't we have some compassion for our white brothers who are clearly hurting? We don't do it because I think some of the ideology doesn't permit it. Also in this book is this, that he compares Tennessee and Connecticut, not Tennessee and Kentucky. Kentucky adopted the Medicaid expansion and called it Connect. Y'all familiar with that? So they were able to help people get healthcare access, including mental health access that they never could before. In Tennessee, they were like, why don't y'all be more like Kentucky? They're like, well, I don't want to put my money into no welfare queens and illegals. I'm like, yeah, but you got chronic diabetes. You need the help. Yeah, I know that, but I don't want my money going to them. That's a racism problem. I'm like, so you're willing to get worse healthcare because you think that is what you need to do to defend, this identity that you've imagined in your head? I'm telling you, racism's bad for human beings. We need to get rid of it. We need to get out of the cycle of blame, shame. We need to find our common humanity, and we need to be pretty bold about asserting the fact that America is a multiracial democracy in which everybody's included.
So I would powerful and important. I want to add one other little element here. Since we started to talk about guns, the approach of many, the NRA and others now, is it's not a gun problem, it's a mental health problem. And it takes it back to the stigma surrounding mental health. We should note at the outset that far more people with serious mental illness are victims of violence.
Right.
And a whole lot are. That in those the small number of instances where you have somebody with a serious mental illness who engages in gun violence at a mass level, in every instance they are untreated. Right. And they're often untreated because of a broken mental health care system where they refuse treatment and nobody can get it for them. And we need to change the way we talk about both guns and mental illness. It worsens the stigma, but it also takes us further away from reaching any kind of agreement on what we do about gun violence, which, as you say, is far more about suicide or domestic incidents. The murders are much more in the domestic scene than more broadly, but that's one other little soapbox that we can deal with in the future. We're going to have to wrap up in a minute. I want you to reserve for you the last word, but also you're a leader in this state. You've proven it in so many ways. I'm hoping you can use that leadership as we go forward to try and pull those stakeholders together in a better way and deal with all of these, this set of problems that we have. We need some resources, it's true, but what we also know from Miami and other places is that a small initial investment actually results in enormous payoffs. Just to pick one example, we know that Minneapolis in the last year, admittedly an unusual year, $100 million in taxpayer money that went out because of the effects of violence involving police. That if we can have less violence, which means more people living, it also means huge savings. Right. So using that bully pulpit becomes an important focus, and you're the guy to do it, and I hope you will.
Well, let me just say that I'm absolutely committed. The resources of my office we will pledge and commit to resolving this problem. It's a statewide problem. It involves all 5.6 million of us, but we are going to pull on the good advice of you, Norm, also Dr. Gilligan, also the judge. We got Larry, man. We got Larry Jacobs here. And we have a great team to move forward. We got Sue Adderholt. I don't know if Sue's still there. We got some amazing leaders in the legislative branch. So Mindy Greiling was speaking, and John Marty was here. And I don't want to leave anyone out. We got great police leadership, Kelly McCarthy and others. We got some good police leadership coming in. Of course, I met Blair Anderson was here, but also I believe Cedric Alexander is game. And we got 2 mayors who want to do this and many more mayors than that. So we have what we need. What we got to do is come together, unify, and not quit. And always keep the victims in mind. Can I close on something? So when Hennepin County passed Hennepin Health, they got a waiver to be able to use Medicaid dollars for housing. They wanted me to come and see how they were doing. And so I went, and they told me how they saved money on the ER, and they told me how they saved money on this and that. And they told me all this stuff about money. But then they introduced me to somebody who was part of the program. And this person said, for the first time in years, my family is willing to let me come home for Thanksgiving dinner. When I was not doing good, they didn't know what to do with me. They tried, and now I can go home for Thanksgiving dinner. And I got tears listening to this person. Think about the mentally ill person, untreated, rejected because they're weird. Just them being able to find human connection and life once again. One of the things that Dr. Gilligan and the judge pointed out is that these illnesses actually are quite treatable. That's not to say everybody's going to be treated, but their prognosis is better than stuff we deal with every day. So let's just make this commitment. If Republicans say that the gun violence is because of mental illness, and the liberals and Democrats say, well, mental illness all on its own needs attention, then we can all get together around dealing with mental illness. You would think, right? So let's just go do it.
Thank you for that. And we're going to wrap. I have one more little thing that I want to add to that. I actually don't like the term mental illness. This is a brain disease.
Okay.
It's an organ disease. It's no different than a disease of another organ. It's no different than pancreatic cancer. I can't tell you the number of times that my well-meaning, highly educated and smart friends and acquaintances would say to me about my son, why don't you just kick him in the ass? As if it were a willful thing.
Right.
If we embrace the idea that people who are weird in this sense have a disease of an organ, we're going to have more compassion for them, but we're also going to find a better way of dealing with them. We've had quite a remarkable morning and early afternoon so far. It is the beginning, as I said before, not the end. Thank you for your leadership. I want to thank Larry Jacobs especially, and Mindy Greiling, Ron Latz, who helped a great deal in helping to put this program together. To Steve Leifman, who journeyed from Miami and is going to have a hell of a difficult time getting back to Miami, as it turns out. To Dan Gillison for his leadership at NAMI. To the University of Minnesota and the Humphrey School itself for all that they've been doing, and they're committed to helping move this forward, to make this state and this city what they used to be, better than it used to be, what they can be, and to be leaders for the nation instead of a punching bag as we have been in the last few years. So thank you all very much.
Thanks, Norm.